Alzheimer's disease is the leading cause of death in a rapidly aging world. There are 5 million Alzheimer's patients in the USA alone. There are 18 million Alzheimer's patients worldwide, and these numbers are supposed to quadruple over the next 2 decades. A staggering $150 billion are spent every year on treating America's Alzheimer's patients, but yet there is no effective treatment available. Research shows that the existing Alzheimer's medications only retard the cognitive decline, and placebo and treatment groups meet at 36 months. However, נירוניקס has developed a patent-pending breakthrough technology capable of diagnosing the disease 4 to 10 years before its clinical symptoms and effectively regenerating its lost cognitive functions. נירוניק's neuroimaging diagnostic device allows for a preclinical screening for Alzheimer's disease for the 60 million individuals worldwide over the age of 65. Such preclinical screening of Alzheimer's disease becomes highly desirable given נירוניק's capacity to reverse the cognitive decline associated with Alzheimer's disease. As you can see in this demonstration of an Alzheimer's patient disease brain regions, נירוניק's technology is based on a combination between נירוניק's neuroimaging, נירוניק's graphic imaging, and נירונix electromagnetic stimulation to produce a non-invasive medical device capable of producing regenerative neuroplasticity effects. We are very fortunate to be led by one of the world's renowned Alzheimer's scientists and clinicians, Professor Martin Rebay, the head of Alzheimer's Center in סופי4 Medical Center.
When נירוניקס asked me if I would like to collaborate with the project, I was puzzled at the beginning because I was not sure what is the idea, but the more I have read about, I become deeply convinced that I think that we have something new for the treatment of Alzheimer's. So I think that we may delay, or maybe we can avoid the development of Alzheimer's. Of course, I really believe that this treatment will be one of them, or maybe the leading approach for the treatment of Alzheimer's.
Hence, our 18 months optimization clinical study will be performed in state-of-the-art research center located in סופי4's medical center.
We have a big team. We have 15 physicians, and also we have a unit for memory problems. I think that we will be able to take over our responsibility and to centralize this study, which I am eager to start. If we can avoid the worsening of symptoms, and we can prolong the mild to moderate status of the patients, even we foresee actually an improvement of symptoms.
In order to expedite the delivery of נירוניק's first-generation diagnostic and therapeutic devices, נירוניקс is partnering with one of the leading technological development companies in the world. ניronics anticipates that its first-generation diagnostic and therapeutic devices will be completed by March of 2009. Moreover, ניronics' second-generation diagnostic and therapeutic devices represents a breakthrough technological platform capable of diagnosing and treating any brain-related disease, including Alzheimer's, dementia, Parkinson's, traumatic brain disorder. Based on this analysis, ניronics' medical business model foresees several possible streams of revenue, which include revenues from its sales and operation of its first-generation diagnostic device, revenues from its sales and operation of its first-generation therapeutic device, and revenues from its sales and operation of its second-generation therapeutic device. As you can see from the graph, based on these multiple sources of revenue, ניronics anticipates a steep climb in its revenue capacity between the year 2012 and 2017. Finally, ניronics' proprietary breakthrough technology also taps into a huge market potential consisting of brain stimulation, brain diagnostics, and management of Alzheimer's patients, which is estimated at over $150 billion. Despite the presence of key medical device, neuroimaging, and pharmaceutical companies throughout each of these arenas, נירוניקס possesses a significant technological edge in its capacity to diagnose the disease prior to clinical symptoms and its capacity to produce regenerative neuroplasticity effects that are capable of reacquisition of lost cognitive functions associated with Alzheimer's disease.